Hey, this is Dr. Ben Pearl with FitFootU. So today we're talking about conservative options for hammer toes. There are both flexible hammer toes, rigid and semi-rigid, and this particular case falls into the rigid or very fixed category. Now this is a patient that is also on some systemic medications for arthritis. She's going to discuss a little bit about that. We're going to take a look at her toes, but we're also going to take a look at something conservative without doing any injections whatsoever, and just using a little bit of spread of the toes with a toe brace in conjunction with something called electromagnetic, which we're going to take just a brief look at. Now, we've talked about this before, but more importantly, the toes. Can you explain what you noticed in the treatment series that we've done with that line you mentioned that you're now able to see?
Well, after the first treatment, which was Monday, this is visibly less swollen. I can tell that because I can see the lines of the bones and tendons, which I could always see in this foot, but this was just a mass.
Because it was puffy.
Puffy, solid. Now see, when I lift my toes a little bit, I can see the bones.
Now, tell us about functionality. I know it's only been very early in the game, but what would you say about the functionality of movement of the toes vis-a-vis them being less swollen?
Well, I think I can maybe move them open. I've just completed the treatment this morning, and they are moving apart.
Which is, it looks a little bit better than where you were before.
Yes.
Yeah. So this is great. I mean, this is after just 2 treatments and hardly any time with the toe spacer that you've been using.
Well, I have been using the toe spacers. I just didn't put them on this morning, but
yeah.
I walk in them and use them every day.
And you don't have to, it's just not realistic to use them 100% of the time. So in closing, what we'll say is that we'll probably look to do another couple treatments with this, maybe 3, maybe only 2. And a lot of it just depends on your availability, but I think we've come a long way. And we at least know now that we have this as a rescue option should you have a flare-up. Till next time, this is Dr. Ben Pearl with FitFootU.